Donald Trump's one big beautiful bill is making Medicaid great again. But millions are losing their health insurance. Yeah, 1.4 million of those people are undocumented immigrants. Why are they getting Medicaid in the first place? First off, Medicaid isn't just for everybody to have free health insurance. What the fuck is this, Canada?
Rural hospital operators are asking for a lifeline in Austin.
Rising costs, patients moving to the cities, and new federal budget cuts threaten many healthcare facilities in those small towns.
We were there as workers covered the emergency room signs at Midcoast Medical Center in Trinity, Texas. The sight of medical workers leaving for the last time, signaling this is one of the latest rural hospitals to shut its doors.
Okay, so the government just pledged $40 billion to Argentina. And in the same breath, it also directed all states to stop Medicaid and SNAP benefits to its recipients. I'm not a conspiracy theorist, but it's ironic that this announcement came a few days before the No Kings protests.
You ever watch somebody set a trap and then step right into it? Yeah. That's kind of what's happening with MAGA and healthcare right now. But before we dive in, I want to say this. If you live in a red state and didn't vote for this mess, I see you. You're out there trying to do the right thing, watching your hospitals close, your neighbors struggle, and wondering how you got dragged into someone else's bad decision-making. This video isn't about mocking you. It's about unpacking how those decisions affect everyone, including the people who tried to stop it. Welcome back to Think Out Loud, friends, the home of caffeine, common sense, and the occasional reminder that actions have consequences. To my amazing subscribers, I see your comments, I appreciate every one of you, and I love how you keep these conversations real. And to our new viewers, welcome. This is where we break down the chaos, laugh at the irony, and sip coffee while trying to figure out why half the country keeps voting against healthcare. Now, it's one thing hating illegal immigrants, but it's a whole other level of wild when you start lobbying for Medicaid cuts thinking it'll only hurt undocumented people. Meanwhile, plot twist, they don't even get full Medicaid benefits. So while some folks were celebrating no more government handouts, what they really did was pull the plug on their own hospitals and nursing homes. Across red America, ERs are vanishing. Ambulances are driving hours. And the same people yelling, "No socialism," are realizing just how expensive freedom gets when there's no safety net. They called it draining the swamp. Turns out they just drained their own lifeline. This, friends, is a full-blown healthcare FAFO. And today we're diving into how MAGA voters went from America first to becoming first in line for medical debt collections. It's wild. MAGA voters are absolutely convinced that the real problems in America are illegal immigrants and, of course, Democrats. Because in their minds, everything bad somehow starts with those two words. I'm just saying, don't come for me, I'm just the guy with coffee and Wi-Fi. According to them, if you come in the right way, then you're totally fine. But if you're undocumented, suddenly you're contaminating the American bloodstream. Their words, not mine. I mean, you can't make this stuff up. Now, I want you to actually hear it for yourself before we get to the part where these same folks somehow decided that cutting Medicaid, the one thing keeping their rural hospitals from flatlining, was the best way to fix that problem.
What's happening to our country is being poisoned, and your schools and your children are suffering greatly because they're going into the classrooms, they're taking the seats, and they don't even speak English. It's crazy. And we have our people that aren't going into a classroom. We have students that were there last year. They're not allowed into the school this year. They're not allowed.
Donald Trump said last week that immigrants are spoiling the blood of the country. Do you agree with that?
When you have an influx like this, there's got to be big time trouble. These people don't always think like we do.
Our country is being flooded by who knows what, bringing whatever diseases in. Why do we have to have open borders? Who decided that we have to have open borders?
I'm here in the Merch Hall at CPAC, the Conservative Political Action Conference. We're here to find out why people came out today to hear a speech from Hungary's authoritarian Prime Minister, Viktor Orban. Here's what they had to say.
What did you think when he said that Hungary doesn't want to be mixed-race people?
He said refugees were welcomed, but illegal aliens, and that's what they are not welcomed. People are not allowed to just come into his country and take it over and take advantage like they do here. There's nothing wrong with that. And no, I'm not a white nationalist.
Isn't that frightening to you? We don't want to be a mixed race people?
Doesn't frighten me at all. I like going to France and having French food and French cuisine. And then I like to go to Britain and I like to have the same thing.
That's not really a racial issue, though.
Yeah, but I mean, what's wrong with keeping your country true to yourself?
I don't want the world here either.
Honestly, I feel like we're kind of full up here anyways. You try to drive on our roads. They're busy. You try to get in anywhere. It's super busy. I think that sometimes you can cut it off.
If Donald Trump becomes president, what would you like to see him do to Democrats?
Escort him to the gallows.
Really? You want him to kill his political opponents?
I didn't. You asked me what I wanted to see.
Right, but you want to see Trump kill his political?
Justice done.
Okay.
Now, I don't understand how one person can carry so much hate in them. Like, that has to be exhausting. Imagine waking up every day, stretching, sipping your coffee, and thinking, yes, time to hate an entire group of people again. That's a full-time job, without benefits. Here's the thing, though. Hospitals don't check passports before saving lives. Nobody in the ER is yelling, "Quick, he's bleeding out, but first, show me your immigration papers." That's not how this works. But MAGA's logic went something like this. If we cut government aid, we'll stop illegal immigrants from mooching off the system. And in doing that, they ended up cutting themselves off. It's like trying to punish your neighbor by setting your own house on fire. Medicaid isn't some random handout. It's literally how most small-town hospitals stay open. It pays for care when uninsured people, citizens, veterans, kids, come in. It keeps ERs running, nurses employed, and doctors from packing up and leaving. But when you slash that funding, everything collapses. And guess where most of these hospitals are? Red states. The same ones that screamed, "No socialism," are now driving 2 hours just to find an open ER. They said they didn't want big government. Well, congrats. You don't have big hospitals either. And what's really wild is that it's not the billionaires who suffer. It's the same working class folks who bought into the dream that less help equals more freedom. They thought, we'll show Washington we don't need their money. Now they're out here holding GoFundMes for medical bills. We're taking our country back, they said. Okay, cool. But from who? Because from where I'm sitting, it looks like you just took it back from your local nurses and your grandparents. They wanted to drain the swamp, but all they did was pull the plug on their own healthcare system. And if you think that's bad, just wait till you see what happens next. Because when those hospitals started closing, suddenly it wasn't about freedom anymore. It was about survival.
We were there as workers covered the emergency room signs at Midcoast Medical Center in Trinity, Texas. The sight of medical workers leaving for the last time, signaling this is one of the latest rural hospitals to shut its doors.
I think how sad it is.
Marjorie Polvino runs the hospital board.
It has a huge impact on the committee. We will lose lives. 400 people a month come here.
In the East Texas piney woods, Midcoast was more than a building. It was a lifeline where babies were born and where the heart of Kathy Courtney's 90-year-old husband was restarted, saving his life.
How many times have you used this facility recently?
I'd say about 6 times in the last 14 months.
The closure, hospital officials tell us, was driven by the same factors that have closed other rural hospitals. Low reimbursement rates from elderly patients' Medicare and Medicaid coverage, which made up most of the hospital's budget. Hospitals in urban areas get significantly more reimbursement from their patients who have private insurance, which tends to pay more. Republican proposed cuts to Medicaid could leave more than 8.5 million people uninsured and force even more rural hospitals to close. A new report finds almost 750 rural hospitals are at risk of closing. Courtney's husband is now home and doing well, but the 87-year-old isn't sure she could drive that far if she or her husband of 65 years had another emergency.
When your husband had a heart attack recently, how long did it take you all to get here?
Probably 10 minutes, 15.
And if you had to go to the next closest hospital, how long would that have taken?
Over a half an hour.
Is that the difference between perhaps life and death?
I would say it is.
Hatred and bigotry is about to cost red states and red voters their hospitals and healthcare, and they have no understanding that that's what's going to happen and that the Democrats are actually trying to fight for them. See, Trump's big, beautiful bill cuts Medicaid, and here's the truth. MAGA has no understanding of how Medicaid works. See, Medicaid isn't just some line item. It's a federal and state partnership. The federal government pays a percentage of each state's Medicaid costs through something called FMAP, the Federal Medical Assistance Percentage. And here's the thing. Red states get the highest FMAP. The poorer the state, the bigger the federal share. For example, Mississippi gets 77% of their Medicaid paid by the federal government. West Virginia, 75%. Kentucky, Arkansas, Louisiana, 70% and more. Meanwhile, wealthier states like California only get 50% of the Medicaid bill federally funded. New York, just 55%. So when Donald Trump and Republicans slash Medicaid, it's not blue states that collapse. California and New York already fund nearly half of their own programs. They'll manage. It's red states that get destroyed. They depend on the federal government's dollars. They depend on the very federal funds that MAGA is now cutting off. So what happens when that money disappears? States are going to kick people off Medicaid who currently qualify. Rural hospitals, which are already barely hanging on, are going to shut down. Seniors, kids, pregnant women, and people with disabilities are going to lose care. And here's the ironic part about it. Most Medicaid recipients live in red states. Blue states will be fine. Red states will lose their safety net. And meanwhile, the Democrats are the ones fighting to protect those very programs in the budget negotiations happening right now. Democrats are trying to keep Medicaid so that the rural hospitals don't close, so that families in Mississippi, West Virginia, and Kentucky don't get abandoned. So let's call this what it is. Trump and MAGA are cheering for cuts that will devastate their own voters. Democrats are trying to save, even while being vilified for it. MAGA doesn't drain the swamp. MAGA drains your hospital, your doctor, and your lifeline. And the coolest part, the very voters that are cheering the loudest for Trump will be the first ones thrown off their health care.
He needs to come down on our level and live like we do. He wouldn't survive, I'm afraid.
Do you have Medicaid right now?
Yes, I do. Yes.
Yes. Yeah.
Yes, I was just approved a few weeks ago.
You know, there's this narrative that a lot of people on Medicaid are lazy. Do you feel that's accurate?
No, absolutely not.
No, I'm not lazy. I try to get a hustle as much as I can.
No, I think they just can't help themselves.
Well, no, because I work. I do mechanic work, and so it kind of fluctuates. I have a bunch of health problems. I can work, but eventually I'll be where I can't work.
Just got laid off.
I'm a hairstylist, so it really just depends on how much I bring in due to my clientele. I'm currently trying to get like a part-time job, like a night job, just to put more money on the table, especially with the economy going up in prices and stuff.
Can you tell me about how it would affect you if you lost your Medicaid coverage?
Oh, Lord, I would have absolutely, teetotally nothing. I would not be able to live, period. I wouldn't even be able to eat.
It would affect me real bad because I can't support myself.
It would be a very big impact because that's all we got right now.
I have some possibly terminal illnesses, and I've had to postpone it waiting for Medicaid. And I'm sitting here literally just trying to survive.
I wouldn't have no coverage at all. My grandchildren wouldn't have any coverage. My daughter wouldn't have any coverage. And we can't just go to the doctor as needed.
I'm curious if you could say something to Representative Johnson about cutting Medicaid, what you might say to him.
Well, Speaker Johnson, I can only say this. If you ain't had the shoes on your feet to see what it feels to be like under these conditions, then you won't never know it. Come out here and stay a little while.
Part of that bill would also give tax breaks to the richest 5%. So billionaires would pay less in taxes. How do you feel about that?
It's basically let's keep the rich rich and the poor poor. They have the money to pay for it. So why would you make them pay less?
After years of yelling about cutting government waste, the cuts finally came, and they hit hardest where people needed help the most. Small towns, deep red states, rural communities that voted overwhelmingly for Trump. Since 2010, more than 190 rural hospitals have shut down across the United States. Most of them in states that rejected federal Medicaid expansion. States that proudly said, "We don't need Washington's help." Well, turns out they did. These hospitals weren't just buildings. They were lifelines. They delivered babies. They treated emergencies. They employed locals. And when they closed, towns didn't just lose health care. They lost jobs, stability, and hope. And now, you've got people driving 2 hours just to see a doctor. You've got nurses leaving for blue states where hospitals actually stay open. And you've got mayors standing in empty hospital parking lots talking about, how did we get here? How? By believing that cutting public programs somehow punishes the people you hate, instead of realizing those programs are what keep you alive.
If you live in Texas and your health insurance is through Star Plus, then you are on Medicaid. If you live in Alaska and use Denali, you are on Medicaid. If you live in Washington and use Apple Health, you are on Medicaid. If you live in Oklahoma and use Sooner Care, you're on Medicaid. If you live in Tennessee and you use 10 Health or 10 Care, you are on Medicaid. If you're in Hawaii and use MedQuest, then you're on Medicaid. If you're in Massachusetts and use Mass Health, you are on Medicaid. If you're in Minnesota and use Minnesota Care, you are on Medicaid. If you live in Nebraska and use Nebraska Health, you're on Medicaid. If you live in North Carolina and use the Division of Health Benefits, you are also on Medicaid. But if you're in South Carolina and use Healthy Connections, then you are also on Medicaid. If you're in Washington, D.C. and use Healthy Families, you're on Medicaid. If you're in Virginia and use Cardinal Families, you're on Medicaid. If you're in Wyoming and use Equality Care, then you are on Medicaid. If you're in Missouri and use MO Health Net, Medicaid. Maryland Medical Assistance is Medicaid. Louisiana Bayou Health, Medicaid. Kansas is CanCare, also Medicaid. Delaware, Diamond State Health is Medicaid. And in Connecticut, it goes by Husky Health. In Arkansas, it just goes by Healthcare. And in Iowa, it's IA HealthLink. Maine Care and Medical Assistance is going to be your Maine and Massachusetts, Medicaid. Sorry, Maryland, not Massachusetts. And New Mexico is Centennial Health, Medicaid. This is what kills me, is that Medicaid has been rebranded in all of the 50 states almost, where the type of health insurance you have does not say Medicaid, but it is funded by Medicaid. So if you voted for Trump, if you voted red to defund in the big beautiful bill any of these insurances, you are going to be affected. So I have found out that a lot of people think that they're not going to be affected because when they look at the card, it does not say Medicaid. It says one of those other names. However, if you look at your card and any of those names are listed, you are going to be affected by this. There's other ones such as Anthem and Molina and United Health that also manage Medicaid programs. So if you take a look at your insurance card and any of the names I've just listed are things that are stated on your card, then you better start fucking praying, because there is a good chance you're about to be affected by these Medicaid cuts and these big, beautiful bills. That these 17,000 per people who are, 17 million people that are about to be affected, it's a good chance you're going to be one of them. Have the day you voted for.
Let me just say this straight. These politicians, they don't care about you. Not the farmers, not the truckers, not the small business owners in those tiny towns they fly over on their way to a fundraiser. Republicans, especially the MAGA ones, need to hear that. Because while they're out here cutting Medicaid, closing hospitals, and calling it fiscal responsibility, they're also signing off on billions of dollars going overseas.
They are not eligible, so they will be coming off. So people are not, well, we all are going to die. So, for heaven's sake.
While the U.S. government is shut down right now, it's one thing to have the president leaving the country and flying to other countries, as Trump did today. It's another thing to have the U.S. government funding another country's government while we are not funding ours. Nevertheless, Trump's Treasury Secretary, Scott Bessent, just sent $20 billion, just sent 20 billion U.S. taxpayer dollars to go fund the government of Argentina, to go bail out their currency for some reason. Argentina's currency has dropped 27% in value already this year, but we're buying $20 billion worth of it. Why is that? That doesn't seem like a good bet. Don't worry, it's just a loan. Right, think we're going to get that loan back? I don't know. The IMF has had to bail out Argentina 23 different times Argentina owes the IMF more money than any other country on earth. The most recent IMF bailout was just in April, and even that wasn't enough to keep their economy and their peso from continuing to tank. But apparently now it's us. Scott Bessent, Trump's Treasury Secretary, nevertheless just gave Argentina $20 billion of your money to prop up the government of Argentina, even though we have almost no trade with them. And if their economy or their currency collapses, that would be sad for them, but it would likely have no effect on us. This is not something we're doing to protect ourselves. It is just a favor to them.
Yep. $20 billion. That's billion with a B. Money your tax dollars helped earn, now bailing out a foreign country. Meanwhile, your rural hospital is a Dollar General now. So remind me again, what happened to America First? It's almost poetic, really. The same movement that said, we can't afford to help the poor, suddenly finds bottomless pockets when it's convenient, when it serves business interests, not human lives. And the wildest part? They sell it to their base like it's some kind of master plan. Oh, this money helps our trade partners. It keeps America strong globally. Yeah, sure. But who's keeping Americans strong domestically? Who's paying for the ambulance that doesn't exist anymore? This is the psychological trap of MAGA politics. It's not built on policy. It's built on identity, on the illusion that we are winning because they are losing. But here's the truth. Nobody's winning. You're just being distracted while the real players cash the check. You think the billionaire class cares whether your county has a hospital? You think the lobbyists who wrote that bill are worried about your insulin prices? Come on. They're popping champagne over how easy it was to sell the lie. And that's what gets me. They call programs that help people socialism, but they don't bat an eye at corporate welfare. It's welfare for Wall Street, and you're supposed to cheer like it's patriotic. So while the base was screaming, no socialism, the real socialists were just wearing better suits. I mean, honestly, at this point, I don't even know if I should laugh or cry. Probably both. But I'll settle for more coffee. And look, this is the part that always gets missed. The MAGA voter thinks they're voting for toughness, for independence. But what they're really voting for is abandonment, dressed up as strength. Because if your leaders can send $20 billion to Argentina, but can't fund your hospital, your schools, or your roads, you're not being led. You're being used. And the question becomes, how many times do you have to be used before you finally say, maybe we've been cheering for the wrong team?
I live in a super rural area in Illinois, and recently our local newspapers have started posting about hospital closures and how Medicaid and Medicare funds our hospitals and our nursing homes, and how there's a lot of fear surrounding Medicaid and Medicare cuts and possible job loss, possible department closures. And there are like about 100 MAGA in each post, and they're just like, show me the data. I want to see the numbers. Show me the financials. Like, they'll understand it. It's just so comical to me. They are telling you, we have already closed our OB department. We have already closed this clinic and that clinic. People are already driving an hour to an hour and a half for healthcare, especially women's healthcare or mental health. People are still in disbelief, like the newspapers, oh, you're just a liberal newspaper. Look at you've gone woke. It's not woke in a bad way to understand how these cuts and these policies impact us, especially in rural areas. Like, you have to wake up and face reality at some point that you voted for this, and now you're going to be impacted. Your neighbors, your friends, your family, we're all going to be affected by this. It's your fault. You have to open your eyes and realize that. You can't just live in denial. They're telling you they're going to close. When they close, are you still going to be in denial? No, you're going to blame it on Democrats somehow.
Out that the reason that some of the poor MAGA don't believe that anything's going to happen to their health care is because they don't realize they're on Medicaid because their state calls it something else. Jesus, fix it. Love you, bye.
You know, when you look at all of this, the hospital closures, the Medicaid cuts, the $20 billion bailout for another country, it's hard not to see the pattern. The people shouting America first are somehow always the last to benefit. It's like watching someone try to drive forward while staring in the rearview mirror. yelling about immigrants, about socialism, about Democrats, but never noticing the cliff they're speeding toward. And that's the part that really gets me. Because the tragedy here isn't just policy, it's psychology. MAGA voters have been conditioned to see compassion as weakness and critical thinking as betrayal. They don't realize that rejecting education, healthcare, and empathy doesn't make them free. It makes them vulnerable. It's not rebellion, it's surrender, disguised as pride. And I get it. Not everyone in those red states voted for this. There are good people out there, hardworking, trying to survive, trying to take care of their families, who are now paying the price for choices they didn't make. To those folks, my heart goes out to you, truly. But to the rest, the ones still chanting, still defending, still pretending this is some kind of master plan, you've got to wake up. Because the people in power don't care about you. They never did. They care about what you can give, your vote, your outrage, your blind loyalty. And the joke's on them. Because eventually, even the loudest echo chamber runs out of echoes. So maybe it's time we all start thinking a little differently. Maybe it's time we choose smart over stubborn, compassion over conspiracy. Because hating other people has never once paid a medical bill. If anything, it just raises your blood pressure. And your insurance still won't cover that. So what's the lesson here? Simple. You can't vote away empathy and expect mercy. You can't cheer for cuts and then cry when they come for you. And you can't scream America first when you're the one getting left behind. Anyway, that's all I've got for today. If you made it this far, you're a real one, and I appreciate you. Seriously, I read your comments, even when I can't reply to them all. You're the caffeine that keeps this little corner of sanity alive. So do me a favor, hit that like button, share this video with a friend, and tell the algorithm we're not done thinking yet. I'm Glenn. This has been Think Out Loud, and after all this talk about hospitals and healthcare, I think I've earned another cup of coffee. Maybe two. Stay sharp, stay kind, and I'll see you in the next one.